there are AIs that make super doctors. So at least that's how I see it. So like doctors that now can track 1 million patients at once. Like there is no doctor that can do this. I think maybe there is someone.
Welcome to another episode of Dev and Doc. This is a podcast where developers and doctors join forces to deep dive into AI in healthcare. My name's Josh. I'm a doctor and an AI clinical researcher, and I'm one of your co-hosts.
And I'm Željko. I am the developer.
Today we have a very interesting topic to discuss, which is, does healthcare need AI? So we're going to be really diving into what AI can do and specifically what it can do in healthcare. And we want to talk about all the different situations where AI can help a doctor or help other clinicians to make healthcare better for patients and for everyone working in it.
Yeah, and address a bit more the current state of AI in healthcare. State in a way like, are there startups that are doing AI in healthcare? Do we see more investments in this field? What is happening with VCs? And just understand a bit more, is the world ready for AI in healthcare?
Let's dial it back a bit, because the last few episodes have been going quite deep and quite technical. But I wanted to take a step back. Maybe the term artificial intelligence is thrown around a lot, and it carries with it is a lot of connotations of hype, of potential, of promise. But everyone has a different idea or definition of AI. I was just thinking maybe we could just delve into what is actually artificial intelligence when me and you talk about AI, Željko.
It is, we can define it. Again, it is not easy to define AI because every day it includes more and more. But in some very simple terms, like AI is the science of creating machines that can do tasks that require intelligence. Now, this is a bit of a tricky definition because, of course, it means what is also intelligence. But you can also see it like, if an AI, if a machine can do tasks that a human can do, then we say that is artificial intelligence.
But it gets tricky, right? Because the definition of AI, in a way, is predicated on the definition of intelligence, which is also a bit of a grey area. Like, you know, you've just described human intelligence, but then also who's to say, you know, other animals have a different kind of intelligence, you know, like a dog or a squirrel or a cockroach even. Who are we to say, you know, AI should be emulating us and not other animals?
No, that is true. That is what, like, the initial definition should be doing a machine doing tasks that require intelligence, irrelevant of is that an intelligence of a cat, of a human, of a mouse, of whatever. It is just tasks that we think, again, it is, we are defining what is intelligence, so in that way we are also defining what is AI. It's a bit of a recursive definition.
Yeah, because there's many aspects of even just human intelligence. I think even experts would disagree, you know, what aspects are within human intelligence. You know, there's things about memory, recall, reasoning, logic, you know, but I'm sure people would disagree or contest what that actually means. You know, does passing an IQ test or getting a high score there mean you're intelligent? Or is it about navigating the real world and, you know, getting a nice job, building relationships with people?
I think all of that are just in the sphere of AI, that's different levels of intelligence, or different, because an AI that can, when we were talking about named entity recognition a couple of episodes ago, an AI that can simply recognize a phone number is a very simple AI. But an AI that can hold a conversation with you and talk about geography, it's a slightly more complicated, more versatile, more general AI. So I think it is, there is a big scale there, and all of it is AI. It's simply different levels. At least that's how I look at that.
But then there's also, I think, a lot of companies that have automation or just, some kind of rules-based approach, call themselves AI as well to kind of ride the hype. But, they aren't really AI as such, but it gets very confusing very quickly.
By the definition of AI, they are AI. Because by the definition of AI, even a rule-based approach is AI. Even you writing a regular expression to extract names or whatever else you can think of, that still is a field, is a sub-area in AI. Again, it can be really advanced AI, which is currently large language models, or it can be the really old AI from 50 years ago, which is pattern matching AI. So I think all of it is just different levels, and yeah.
But so a minefield of definitions, basically.
No, exactly, yeah. But I think the question, that is important here is, can any of these help with healthcare? Can any of these help us? Does in fact healthcare need AI? What do you think? Like, do you think, from your perspective as a doctor?
I think I might be a bit biased since I work in AI research, but I honestly do think doctors, given the current state of the National Health Service in the UK, we need technologies and we need AI to really help clinicians deliver what we want to deliver. Because I don't know if you've seen in the news, there's strikes, there's, the funding is getting worse, there's more and more patients. Just the actual burden in the hospital is getting more and more severe compared to 10, 20 years ago. And it's really sad because, I was working in the emergency department the other day, and just the waiting times was just incredible. Like, there were over 20 patients just sat in the waiting room. It's 4 or 5 hours to be seen by a doctor. I could see them, giving treatments whilst the patient sat in the waiting room. I mean, this is not what I expect in the United Kingdom. And it's very sad, but something needs to happen. And, clearly funding is an issue, but I think there needs to be some kind of intervention to free up time for more clinicians to deliver care to patients. Part of that is improving work conditions, hiring more doctors, but also I really do think AI and other technologies could help streamline a lot of this burden.
Do you think that doctors are also today spending more time with patients than before? Just because, I don't know, I think medicine is advancing, so we know more diseases, we know more, there is more medications, there is more, even just looking at the history of a patient, there is more recorded history. Do you think it is getting more difficult?
That's interesting. I think because of all those previous notes, in some ways it's easier, but maybe it takes more time to read through. Because back in the day, and I've worked with even the old school consultants I work with now in the emergency departments or in acute medicine, they often, there's particularly one consultant who will never read the previous notes and he doesn't want to hear from you. He says, look, just come, we'll go speak to the patient and we'll just do everything from scratch right there. But I think as a more modern doctor, it helps so much. All the notes are there for me to read through, to take into account, to contextualize the visit. Obviously, I'm not, I haven't decided on a diagnosis and I'm still open to signs and symptoms and history. But I know, if someone has a chronic condition like COPD and they're getting frequent exacerbations, very likely if they've come in short of breath again, it's something related to that. I would also look for other differentials to rule out, but that really helps a lot. So to answer your question, I think we have more information, so it's easier to do a more concise history, but it takes longer to read through notes, for sure.
Yeah.
And this is where maybe we go to what AI can do for us. We have talked about AI automating some of these tasks, like menial tasks like summarizing text or recording consultations.
Yes. Yeah, in fact, there is a very nice paper that came out recently on summarization where they are comparing so they're doing clinical text summarization, and they are comparing large language models to human experts. And what they basically show, so we can link the paper on screen and put it in the about box, but what they show simply is that there are cases where the large language models outperform a clinician summarizing the history of a patient, so the clinical notes. But they do also, I don't want to be like too happy about that.
Too
so
hype.
I think there are limitations. There is still a lot there that has to be improved. We still want to make sure there are no hallucinations, because they do remark that in some cases the model hallucinates and adds some conditions that the patient doesn't have, or maybe infers some condition that are really not written in the medical history, which is not I think like that's not the goal of someone summarizing. You should not infer conditions. You should just summarize what is really there.
Yeah. Yeah, you should only be giving the existing information in a more neat package, really.
Yeah.
Yeah. But that's interesting. Because there was a similar paper, I think a month ago now, where they also looked at not just the completeness and correctness of the summaries, but also just if these large language models have empathy. And I think they took like Reddit comments from a kind of doctor's subreddit, and they found that actually like the machines can also display a degree of empathy that users are happy with.
That was a slightly tricky paper, a slightly controversial paper, in fact. Yeah, because they were also comparing that to really responses from doctors on Reddit. So a Reddit user would ask a question about some medical condition or something, and then a doctor will respond. But again, this was on Reddit, so this was not a doctor on duty doing stuff, but it was just someone after a 12-hour shift writing down, answering
is it
question.
even a doctor? Is it like a 10-year-old kid from?
And it was also a bit controversial because the validation was done via large language models. So what this means is that you take one of these user questions, you answer that question with a large language models, and you also take the top answer provided by a doctor on Reddit. And then to compare which one of these two is better, what they have done is they used a language model to say which one is better. So
it's biased. It's flawed. It's not the best method. Because obviously the large language model would prefer their own
itself,
or like a similar model's output.
That's a very good question. I don't know. Would it prefer the correct question or the one it wrote? That's something that can be. I don't know. Did anyone do a study on that?
They must like themselves. I mean, if they're outputting, if they're outputting what they think is correct, obviously, surely the other way around, inputting that, they would think that's the best. But maybe another research paper.
This would be an interesting one. I completely agree. Does it prefer itself, or even does it prefer other language model over itself, or does it prefer the really correct answer written by a human? That could be a nice study. Maybe we should do this.
Yeah, or maybe if the listeners know, they can chime in the comments and let us know what they think.
True, yeah. Or if someone has already done it or is doing it.
Yeah. So what else? Yeah. What else can AI do? So we talked about kind of summarization and maybe recording consultations and kind of scripting the documentation, which would free up time. What other things have you been looking at?
So I think here we can divide these. What can AI do? At least am I dividing that for when we are looking at patients and doctors, or more specifically like doctor-facing AIs. I think there are AIs that can make the doctor more efficient. So save their time, free up their time, and have them focus on what they really want to focus on. So these are the models like summarization, like ambient note taking, so something that will record the conversation. So these are just models that are basically doing tasks that doctors are already doing every day and spending quite a bit of time on it, and they're just now making it much faster. I think on the other side, there are AIs that make super doctors. So at least that's how I see it. So like doctors that now can track 1 million patients at once. Like there is no doctor that can do this. I think maybe there is someone, but it's hard. So a doctor together with an AI can track 1 million patients, because that AI can rank those patients, predict risks, try to find any anomalies, anything that is not right, anything that can alert the doctor about a problem, and then the doctor can jump in when it's needed.
Okay, so like live risk stratification and monitoring through patient observations and notes, essentially, right?
Yeah, I would say something like that. And of course, I mean, there is more there. AI that can detect problems from X-ray images, or something that can... Yeah, sorry, go ahead.
Yeah, no, so I read a similar paper, actually. They called it kind of superhuman performance. It's where they got a group of radiologists, and I think they presented them with a number of CT scans, like scans of the chest, to look for things like cancer or pneumonia, chest infections, and other things. I think there's over 10 pathologies they were looking for. And what they found was, each out of the 10 radiologists or something, there was obviously variation between the more experienced one and the less experienced ones. But then what they did is they combined the radiology with an AI, like a convolutional neural network, like a image AI, to basically detect abnormalities in the CT scan. And they found that basically everyone, even the lowest performing radiologist, had boosted up the level to the highest one. So everyone was basically, AI assisted cyborg / super doctor. So even the most inexperienced became as good as, if not better than, the most experienced without AI.
That is awesome. And what I also think is that what will happen is that we will have AI being able to detect things that a human cannot. So like I remember one study from, I think it was 2017, where they have looked at retina scans, and an AI was able to tell the sex of the person just based off of a retina scan. And I think even today we still don't know how, or I don't think there is a difference between a male and a female retina.
No, not to the human eye. Like it's, there's a lot of papers, and I think that was a Google paper, right? I think there's a lot of these papers, deep learning in various images, finding links in images that we cannot see from our human eyes, but there is clearly some difference where you can figure out the gender, or I think even age, and different things like that was correlated.
Yes, it was also cardiovascular risk, I think, from retina scans.
Yeah.
But
It's very good. It's very good.
Yeah, and I mean, it might seem silly that now we can tell gender from now we can tell sex from a retina scan. It might seem silly, but what this shows is that AI can see patterns that are maybe not visible to a human. And when there is a lot of data, then AI can extract those patterns. AI can somehow understand that, and maybe by that find like new biomarkers for diseases. Or
absolutely, or new risk factors. Last episode in the large language model episode, we talked about risk stratification, and for things like atrial fibrillation and the risk of stroke. These studies were done decades ago, and the researchers self-selected the comorbidities that they thought was relevant to a risk of stroke. And then as time progresses, you see these scores change all the time, like Chad's VAS score, Q-risk score, changes every few years because they realize, okay, oops, I didn't include this risk factor in the first analysis. Oh, okay, now let's add this on. Okay, now there's 4 more letters to the score. It happens all the time. So definitely machine learning would be really useful to tease out these risk factors.
Yeah, and this then basically makes the two areas, so having more efficient doctors and on the other side having super doctors. So I think either one, I think of course it's much easier to start with the more efficient doctors. It is a much simpler approach, but I do think over time AI will be necessary in healthcare. Like it will be required. It will be a must. I don't think it will be possible. In fact, I do think this for every field. I think like AI is the future, and the same way like today it is hard to imagine a workplace that doesn't have a computer. I think the same will be, or that's not using, I don't know, some software. The same way it will be hard to imagine a field that's in some way not interacting with AI.
I completely agree. I think the question I have in my head is, I have no doubt AI will be used more and more in healthcare and other industries. The question I have is, will it be within our lifetime where we see like a big transition? Part of me hopes yes, but I think realistically, I don't think it's going to be, I don't think we'll see it completely take over in our lifetimes. I don't know what you think about that.
I'm like 100% we will. But I'm also very optimistic from this side. Like I want it to happen. So that's why I'm also saying like 100% it has to happen. And if no one else does it, then we should do it. But there are also some indicators of these. So we can maybe now go a bit more into the industry side and VCs and startups. Recently, we have seen a couple of AI in healthcare reports. So one was from the VC A16Z, a US VC, where they have put out a report on what is needed, what should startups do in healthcare and AI. So they have identified something like 19 different fields. And we'll come back to that, but just to mention a couple of others, I think there was also a report now by FDA that was published on future applications of AI in drug development. There was a report by Bloomberg. So like stuff is happening, and I love seeing this. So I love seeing that finally there is a lot of buzz being created and there is some movement happening for AI in healthcare. Industries are making the move, so it's not just universities.
Not just, because lately there's always, a lot of funding available for universities and for hospitals. But less for actual industry healthcare related. But I also saw a recent article from, Y Combinator, the other VC in the US. I think in the last round they invested in something like 15 health tech startups. And over half of those were AI, specifically natural language processing. So, doing the things we just talked about, automating, clinical note taking or summarization or clinical coding. So it's a massive. There's definitely a buzz and definitely money going into this.
Yeah, I mean, it is very nice to see this. It is. I think it is very nice, and I think it is at least to some extent an indicator that I hope we are at the start of the healthcare revolution, or that healthcare is ripe to basically be changed and be I don't want to say just improved, but modernized.
Mm-hmm.
Let's say it like that, because I still think, like, I was chatting with a friend recently, and one of the things we were discussing, like, it is still very it is still so outdated that the way we contacted the doctors and reported our problems and all of that is the same between 50 years ago and today. You still call your GP, you talk about your symptoms, they write it down, and then possibly you come in and do something. Possibly you have another call or another 5 calls with 5 different doctors, and there must be a more efficient, effective way in doing that. So now I'm switching a bit more to the other side of, like, where can AI jump in? This is more on the maybe patient facing or interaction between patient and doctor, or how does a patient start their journey. But there is so many areas that I think are ripe for change.
Yeah. I mean, you're right. It's still very archaic, and I think you oversimplified it. You don't call your GP now. Most likely is you call 111. You tell them your story. They say, okay, it's not an emergency. Call your GP. You call your GP. It's the admin person who you then repeat your story to, and then they decide how quickly you need your appointment. And then maybe you call your GP, and then you tell them the story again for the 3rd time. And then they decide, okay, it's not emergency, but maybe book yourself in for an in-person appointment next week.
3 months. Yeah, exactly. 3 months
or like 3
later,
months. Let's be honest.
Yeah.
It's a sad state of affairs.
Yeah, okay. So it's much worse than I presented it. I was a bit too optimistic maybe, but so you just show that maybe it is also much worse. It is, you do 3, 4, 5 times, you say the same thing. And I also think your story changes between those 5 times because you are constantly repeating stuff. And
AI needs to come in, but it's stuck. We do a lot of research and we work in hospital. We implement NLP models, but a lot of it is stuck in this kind of gray area where it's between research and implementation, but it doesn't fully take off. And in order to do that, there needs to be, like you said, industry funding to really take it forward. So why don't we actually have a look at this report? Because I think it's very interesting, actually, that the one you mentioned from A16Z. Should we have a look at it? Yeah.
No, for sure. So just a brief introduction to the report. So they're basically talking about the AI jobs to be done in healthcare. They've identified something like 20 different fields. They have covered, I think, a lot. So this is some of these sub areas that they have identified, or fields, are very, very large. Like some of them can be subdivided into 100 different subfields, or like it is not a job for one company to do this, but it is a job for 100 different companies to try to attack one of these fields. So I think there is so much potential here that they have identified, but it is very, very broad. So just to set the scene.
But it's good because as far as I know, I have never come across someone who tried to just categorize in a systematic way the opportunities for AI in healthcare. It's, for me, it's very much, I'm constantly thinking, what can I use it for? What's the next use case? But it's good to see a kind of more systematic approach.
Yeah, and they have done this in collaboration with hospitals. So they really went to hospitals and asked, where do you see AI? What do you want to use it for? What do you need it for? So it was not like they sat down and started thinking, but no, they really went to hospitals. I think it was only US, we can confirm, but still.
Yeah, this is a really nice figure actually. So they seem to, it's, if you can imagine, it's a chart with two axes. On the y-axis is clinical to non-clinical, and then from left to right it's consumer facing to professional facing. So was there anything that stood out to you in particular, Joko?
I mean, yeah, the ones I liked were the ones we are also mostly working on, I think, are the clinical decision support, which I probably think is the one of the most complicated ones. It's extremely professional, very clean. So on the chart that they are showing, it is basically as high as possible on the y-axis, so it is very clinical, and it is also as high as right as possible on the x-axis, so professional facing. So it's facing towards doctors, and it's very clinical, of course.
Yeah, so that's clinical decision support, medical image analysis, and kind of quality monitoring and reporting. Yeah, all of those are really hard. And it's important to say clinical decision support is not even the end. We dream of a day where AI can do clinical decision making, maybe one day. But support is just giving advice or support to a clinician, like we said, maybe for the super doctors. But one day, if it gets good enough, maybe it can make those decisions itself.
Or at least maybe the easy decisions. Maybe it can propagate to a doctor if it's something very complicated, and if it's something easy that the AI has seen a million times. There is one thing here, in fact, I have a question for you, and I'm just wondering, how are you thinking about this? If I'm looking at countries where healthcare is not the best or not available, do you think in cases where maybe a doctor is not available, is it better to have an AI that is a doctor, so a medical AI, making a decision? Or is it better not to do anything?
This is very philosophical.
No, I agree, of course. Yeah, but I'm just thinking, like, there are cases where there is no doctor in my village, and the only thing I can do is either ask an AI or not do anything and just wait.
Yeah. I think so this is so tough because, I mean, first and foremost, as a doctor, we've taken the Hippocratic Oath, or whether you've taken it or not. I mean, I think you should aspire to the principles of doing no harm to your patients, and working for the benefit of the patient. You're probably right. If there is no doctor, then I think from a numbers point of view, let's say you have 100 patients, and let's say they had no clue what to do. They have zero medical professionals in the village. Then probably, an AI would suggest something sensible. Like, we have tested that in our papers. Usually it's something relevant, and then they can go somewhere. But the problem is, I think, so in 100 patients, it might give sensible advice to, let's say, 60, 70%. But then it could give horribly wrong advice for the other 30%. And that's the ethical bit, right? Like, can you say consult an AI, given that there is a degree of false negatives, or a degree of giving wrong advice that could harm the patient? That's the tricky bit, and it depends on your ethics. But personally, I can't see something like that being approved, or I would never personally back that for even if it's a village with no medical input. They just need to call someone, or I don't know, if they don't have phones, they just it's very tough. It's very tough. Yeah.
No, okay, I just want to basically see, so the main concern is the AI giving advice that can seriously harm someone.
Yeah, that would be my concern.
Okay,
Yeah.
that makes sense. I was not really thinking about that. I was just thinking like, okay, it can help 60%, but then what you would need to do is somehow try to find a way so that if it's not sure or if it doesn't know, that it should not say anything, or try to make it so that maybe even the decisions it is making cannot threaten someone's life, can only be like, I don't know, can only maybe escalate, so that if someone comes to the eyes like, okay, I'm having this pain here and all of that, maybe it can escalate sooner rather than later. I don't know.
Okay. Yeah. I think that'd be a lower hanging fruit. So you're saying instead of a large language model that can give amazing conversation, it essentially boil it down to a binary output, like seek help or relax for a bit.
Maybe something like that. Yeah, I don't know.
It's
but
a coin
it is.
toss.
Yeah, I agree that it is hard. I do always remember that there is this guy on YouTube that is always posting about, I think he's called like glaucoma flecken or something like that.
Oh, him. Yeah, he's funny.
Yeah. When he posts about rural medicine, and he's always saying like, oh, when someone in a rural area comes to the doctor, it usually means they're dying. Like it is something really serious. So they don't come for, oh, I cut my finger a bit. No, they cut like I'm missing an arm.
Yeah, definitely. I mean, he's quite right. Obviously the bar is higher if a patient has taken the effort to, I don't know, drive to the next village that's like an hour away. It's usually something more sinister than, us picking up the phone or just calling a doctor that with minimal effort, right? So it usually is something quite bad. Yeah. One thing that stood out to me was the non-clinical, so on the bottom axis, kind of non-clinical in the middle, like they talk about kind of payment, collections, and kind of bills and claims process. So here we call that clinical coding. So, when a patient comes in, they are seen by a doctor, by a nurse, by a physio, etc. We diagnose, we give treatments, and the way the NHS works is the hospital then gets reimbursed money based on what diagnosis it is and based on what happens to a patient, like what investigations are done, what treatment is given, and that money then gets paid back into the hospital. The billing process or the clinical coding process is done by a separate team to the doctors, because obviously doctors don't have time to do this. So it's done by a separate team. So this is a very interesting, I think this is one of the things which a lot of those startups I mentioned from the Y Combinator are aiming to do. So automate, or at least semi-automate that process. I know you've had experience doing this kind of thing, but in a different domain, in a legal domain, is that right?
Yeah. I mean, what we have done, or what I've done in the industry when I was there, is just that what you can do for legal contracts is that if you have a big contract between two entities that is hundreds or even thousands of pages, so what you can do is easily extract the most important parts of the contract out and extract risks, extract obligations and all of that. So I think this approach is translatable to clinical coding, which just means you have an episode of a patient and you want to extract the diseases, medications, what was the diagnosis, so that you can basically build whom are you billing, in fact?
So I guess it's the kind of overarching governmental body that of health departments that reimburses payment by results, they call it. But do you think it's a higher bar though for medical documents over legal documents? Do you think we need to be more on top of it with medical.
I mean, this is clinical coding. So
Yeah.
I do think we can tolerate some mistakes, because the worst thing that happens is hospital doesn't get some money. So
Or they get overpaid.
yeah, or they get overpaid. Exactly. So I don't think it is like, there are no consequences for someone's life. So I think it is a nice area to jump into, just because easy to do, consequences much lower. So I think probably similar to the legal industry, maybe even slightly lower. Lawyers get ultra angry when you mess up something from a contract. So I think this one is maybe, I don't know. Also, hospitals will probably get angry if they get underpaid. So I'm sure, I'm sure it's a similar bar.
Yeah. And we have published on this as well. I feel like I keep saying this. We publish a lot of things, but yeah, we have automated clinical coding as a use case. We automated a national stroke audit. We can link the paper in the video, but this is something very doable. Yeah.
Just to stop repeating ourselves, we'll link all papers we mentioned either in the video or in the description. We are constantly saying like whatever we are talking about is usually backed by some papers, and we'll try to put the papers on screen or link them in the description so that you can read them later if you are really interested.
Yeah, you have Jauko's pledge of quality and evidence base in this podcast.
We do try so that it's not we are just talking, but it's really backed by some evidence, some scientific research.
Yeah, absolutely. And on talking, I just wanted to touch on this because I've seen a few companies now, the talk therapy. So in the top left, so kind of clinical, but consumer facing. So this is facing the patients. Talk therapy, AI-driven talk therapy. Like we went to a conference recently and we saw at least 2 booths, right, for this kind of thing. Very interesting. Delivering usually cognitive behavioral therapy because that's the NHS opted, evidence-backed form of counseling therapy. But it can be given by a machine now, apparently. I don't know how good the outcomes are. Did you have a chance to speak to the booth?
I don't remember exactly, but they had a very positive feedback. So it was not, I don't know, I don't think they had anything yet like published, or they still didn't have some concrete evidence on that, but general feedback from users was like a 5-star rating on the app that they were using or something like that. So I do think there is a lot here. And again, it doesn't have to be really some extremely difficult cases or something where you really need a psychiatrist, but the cognitive behavioral therapy I think is a nice area and can be done with a ChatGPT, especially not with ChatGPT, with a model that is especially made for that.
Yeah, fine-tuned. Yeah. No, I remember the booth. One of them was actually, instead of talking to the software, you type to it. Do you remember that one? So it's a CBT delivered through typing.
Yes.
On your computer, and they claimed that the typing was better than speaking to a real counselor.
Okay. Interesting. Okay. I'm not too sure.
But the point is it's interesting. I think it is, because the wait list for talk therapy is often even longer than to a GP. So, and especially since the pandemic, I think we're more aware of our psychological health and our mental health, and I don't know, a lot of people suffered during that time. It's good to have something that can even you can question how useful it is, but it's quite nice to just deliver this whilst they're waiting to see a human, or it would be helpful. I think it's a really nice thing to do, actually. And
I always think it is nice if you have a human in the loop, so that not a human overseeing things. If you have your talk therapy that is done via chatbot or something, you can have a psychiatrist occasionally, once a week, once every 2 weeks, whatever, check what was the topic, what did they discuss, is everything okay, is the patient going down, or are they recovering, and like that you make it much more secure. And even you can have again some small alerting system that is, when the AI notices that, oh, this patient is becoming very negative, or there are some dangerous thoughts or something like that, then you can alert the psychiatrist. So
yeah, and I just wanted to add, so this is like a pet peeve of mine actually, but you mentioned psychiatrists overseeing this. So in the UK and a lot of countries, it's really fragmented and it's very strange. So you have the psychiatrist, which diagnoses and gives medication, and then you have a counselor or a psychologist that then sees the patient and delivers counseling. So it's segregated. But then you also have neurology, which is what I work in. And so for any like organic diseases from the brain that they say doesn't necessarily affect your mental health, but we know a lot of them do, that's also separated. So it's really segregated. And I think, I don't know, maybe this kind of human in the loop, maybe a way of, or human oversight, maybe a way of bringing together some of these disciplines actually, and like you said, providing a good bird's eye view. But it can't just be a psychiatrist. It needs to be multidisciplinary. It needs to be a neurologist, psychologist, psychiatrist. But yeah, that was just like a random pet peeve of mine. I don't know why it's so split.
No, but I mean, that would be, of course, awesome. It would be great if all three of them could have a look at the chat between the patient and the GPT model, and occasionally once a month check the summary, see how is the patient doing. I think would be nice to combine that. Yeah. Do you want to run through the others just quickly, because I think there is a lot here and we could discuss these for years, but maybe just quickly mention a couple of others.
Yeah, so we haven't looked at the center where it's kind of between clinical and non-clinical, and between professional and consumer facing is stuff like referral management or scheduling. This is a big one as well. Knowing where a patient should go, and then knowing how quickly to schedule them and whether they can turn up. A large part of the NHS, unfortunately, people that need to be seen often don't turn up for their appointments because of various health issues or transportation or mobility issues. So this is something which also needs to be looked at very closely. There are AI models that have been created to try and predict the patients that would not show up in a clinic appointment. But then the question is, what do you do after, you've identified a group of patients that might not turn up? Like, what do you do then? Do you try and see them at home? Do you try and call them? Do you try and book them some transport? But this is a big problem, because I would say at least 10% of my appointments, the patient doesn't show up.
There was a paper we've been working on, I think like 5-6 years ago, that was really predicting did not attend. And it was exactly that. So you are trying to predict, will someone attend an appointment or not? And it is important to predict someone will not attend, just because if you can do that usually a day or two in advance, then you can usually call the patient, make sure everything is fine, make sure they will attend. And usually, I think what we have seen then was that if you do that, they usually are more likely to attend. So if you really call the patient on the day before and remind them and ask them and confirm and all of that, or at least they can cancel so you can have someone else.
Exactly.
So that part was important, I remember.
Yeah, but then there's the other side. So I twisted my neck. I got a physio appointment, and there's a new company I think it was called Doctor Doctor, that coordinates the scheduling. They sent me a text giving me the time and the location. Great. But I got better and I realized I didn't need the appointment. So I clicked on the link. I cancelled my appointment, cancelled my phone call appointment. And then on the day, they called me anyway. And I said,
Okay.
look, I thought the whole point of this app was that I cancel it to give space for someone else.
Yeah.
And then they're like, oh, okay. And then they said, oh yeah, I could see on the system you cancelled. And I was just there like shrugging like, okay.
Okay, it's still new technology. Give them a bit time.
I mean, it's not technology, this is scheduling. You know, there's no AI in this needed.
I don't know. Give them a bit time. They do need a bit of time to just make sure that when you cancel you don't really
I
want
cancelled
it.
in good time. I cancelled in
Yeah.
a week in advance. But yeah.
No, but yeah, this is an interesting area. I think this is a bit of a mix. Is AI needed here or not? Because I think a lot of these, like scheduling, can really be done even without AI, can be made more efficient.
Yeah.
But
Yeah.
AI can help maybe just to predict some of these things. But yeah, it's a interesting area for sure.
It's really interesting. And I really love this approach, jobs to be done by AI. Yeah, I think the listeners have a listen and have a look at this chart. It's really interesting. And I think hopefully this will start bridging the gap between the research we're doing and the use cases we're building in hospital to actually becoming a fully fledged, company or entity that has AI operating in multiple sites. That's the next jump. And I really hope that with the funding and expertise and the attention from the media, that this can happen in the near future.
Yeah, I agree. I think it is awesome to see these, and it's awesome to also see many other VCs next to A16Z and even governments putting money into AI for healthcare. And I think we are at the start of a healthcare revolution. So that would be it for today. Thank you very much for listening. Please subscribe. If you have any questions, ask us in the comments. We always read everything. We are happy to answer. We'll include some questions in the episodes if we find something that is interesting and that everyone else might be interested in. So comment and subscribe, and we'll see you next time.
See you on the next one.
Bye-bye.